Father of nursing, Florence Nightingale. First nursing theory, environmental theory. First trained nurse in India by Kashibai Ganpat. First nursing college in India, RAK College, Delhi, 1946. First school of nursing in India, Government General Hospital of Madras, 1871. First male nurse in India, Mr. Raja Ratnam. Nursing process first step, assessment. Last step of nursing process, evaluation. Nursing process mnemonic, AIIMS. First Nurse Registration Act in India, the Madras Nurses and Midwives Act 1926. First Indian nurse to get Florence Nightingale Award, Edith Helen Paul. Founder of modern nursing in India, Florence Nightingale. Full form of AIIMS: Assessment, Diagnosis, Planning, Implementation and Evaluation. Legal record in nursing, nurse's notes, bedside chart, clinical record. Incident report, filled after unusual event, cardex, quick reference about patient care. Problem solving approach in nursing, nursing process. SOAP charting, subjective, objective, assessment and plan. Pie charting, problem, intervention and evaluation. Normal temperature 36.5 to 37.5 degrees Celsius. Normal pulse 60 to 100 beat per minute. Normal respiration 12 to 20 per minute. Normal BP 120 by 80 mm of Hg. Hypotension less than 90 by 60 mm of Hg. Most common organism causing nosocomial infection, E. coli. Best method of sterilization of surgical instrument, autoclaving. Autoclave temperature and pressure 121 degrees Celsius, 15 psi, 15 to 20 minutes. Boiling kills most organisms in 10 to 20 minutes. Best in disinfectant for HIV, HBV blood spills, 1% sodium hypochlorite. Chain of infection first link, infectious agent. Chain of infection last link, susceptible host. First activity after admission, orientation of patient. Best position for unconscious patient, side lying. Position for shock, Trendelenburg. Position for lumbar puncture, lateral flexed. Position for anema, left lateral, Yasim's position. Position for pregnancy check, Leopold's maneuver, supine. Position for gastric lavage, left lateral. Position for spinal anesthesia, sitting, lateral decubitus. Hypertension, more than 140 by 90 mm of Hg. Best site for core temperature, rectal. Least accurate site for temperature, axillary. Most common pulse site, radial artery. Best pulse site in infants, brachial artery. Best way to prevent infection, hand washing. Universal precaution, treat all blood and body fluids as infectious. Commonest hospital-acquired infection, UTI. Fowler's position, semi-sitting improves breathing. Orthopnic position, patient sits leaning forward, COPD relief. Angle of IM injection 90 degree. Angle of SC injection 45 degree. 90 degree if the patient is obese. Angle of ID injection 10 to 15 degree. IM site in adults, deltoid ventrogluteal. IM site in infants, vastus lateralis. Maximum volume for IM injection deltoid 1 ml. Maximum volume for IM injection gluteal 3 to 5 ml. Length of NG tube in adults 50 to 60 cm. Best method to confirm NG tube placement, X-ray. Gastric lavage contraindication, corrosive poisoning. Minimum urine output per hour, 30 ml per hour. Daily fluid requirement adults, 2000 to 2500 ml. Best indicator of fluid balance. Daily weight. Maximum volume for IM injection gluteal 3 to 5 ml. First sign of hypovolemia, tachycardia. First sign of hypoxia, restlessness. First sight of cyanosis, lips and nail beds. Serum sodium level 135 to 145 milliequivalent per liter. Serum potassium level 3.5 to 5.0 milliequivalent per liter. Calcium normal level 8.5 to 10.5 mg per dl. CPR compression to ventilation ratio adults 30:2. CPR compression rate 100 to 120 per minute. CPR depth in adults 5 to 6 centimeter. First step in BLS, check responsiveness. Hamlet's maneuver used for choking. Oxygen mask delivers O2 concentration 40 to 60%. Nasal cannula delivers O2 concentration 24 to 44%. Tracheostomy care priority, maintain airway. First aid in epistaxis, pinch nose, lean forward. Normal daily calorie requirement 2000 to 25 kilocalorie. Daily protein requirement 0.8 to 1 gram per kg body weight. NG tube insertion position, high Fowler's neck flexed. Anima position, left lateral या SIMS position. Catheterization commonest complication, UTI. Adult urinary catheter size 14 to 16 French. Female urethra length 3 to 4 cm. Male urethra length 15 to 20 cm. Stool test for occult blood. Guaiac test. Riles tube, another name NG tube. Best site to check IV infusion complication, insertion site. Best site for central venous catheter tip, superior vena cava. Hypothermia, first sign shivering. Hyperpyrexia, temperature more than 41 degrees Celsius. Hypothermia, temperature less than 35 degrees Celsius. Glasgow Coma Scale, minimum score 3. Glasgow Coma Scale, maximum score 15. Isolation for TB, airborne precaution. Isolation for hepatitis B, standard precaution. Isolation for chickenpox, airborne plus contact precaution. तो ये थे नर्सिंग फाउंडेशन के 100 वन लाइनर्स, एकदम एग्जाम बूस्टर। अगर आपको ये वीडियो हेल्पफुल लगा तो लाइक करना ना भूलें, सब्सक्राइब करके जुड़े रहिए अगले वन लाइनर सेशन के लिए। अगला टॉपिक और भी धमाकेदार होगा। बेस्ट ऑफ लक।